And welcome back to Body Beautiful. I'm Janelle Marie. We are here with Dr. Joseph Mealy, and we are talking about plastic surgery procedures. Our final one, Dr. Otoplasty. What
Ear
was that?
changing.
Oh, for
It's
the
ear
ears.
changing.
Ear changing. All right, what is otoplasty? And
So-
you know what? We're going to show pictures, and so we're just going to talk over the pictures, so enjoy. But what is otoplasty?
So otoplasty, usually the most common thing we're doing is changing prominent ears to make them less prominent,
Okay.
or ear pinning, bringing
Which
them
is a
back.
pretty big problem, especially for young kids, right?
It can be, yeah. Sometimes it's a source of teasing. Sometimes
Exactly.
it's just like they look in the mirror and don't like the way that it looks.
Exactly.
But it's a fairly routine procedure. It can be done outpatient.
Okay.
I'll often do this either under anesthesia or under local, depending on the motivation of the patient.
Okay.
For younger children, local doesn't usually work well.
No.
But for adults, it can work fine.
Okay.
As
So what
long
do
as
you
they're not
do?
too nervous about it. So essentially, we make a little incision in the back of the ear.
Okay.
And remove a little skin and change the shape of the cartilage. So the cartilage
Wow.
is what gives the shape to the ear and what makes it prominent.
Oh, okay.
So ears can be prominent because the cartilage isn't completely folded, so this last fold doesn't fold the top of the ear in. Or it could be because the concha, which is the part that catches the
Like the
sound,
shell.
is big, or it's rotated forward.
So you just do a little incision, take a little of the cartilage out?
Depending on what the problem is. If the concha is fine and it's just the outer part of the ear, I can just reshape the ear. If the cartilage is large, then we remove a little bit and kind of fold the ear back.
What's downtime for otoplasty?
Downtime, the hardest part is I leave the head wrapped for about a week.
Oh, okay.
People don't like that part.
No.
But it's really important to get the right shape, and especially when sleeping, to make sure nothing moves around.
Gotcha.
The ears after a week usually look pretty good.
Okay.
Sometimes they're bruised, usually they're a little swollen, but they still look pretty normal.
And both men and women for this procedure, correct?
Both men and women. And I think for women, if longer hair, it makes it easier.
Exactly. It's so much easier to cover up.
Yes.
But the men, sometimes it's just, if the men have really short hair, it can be quite obvious.
It makes the ears more obvious because,
Yeah.
again, with women, sometimes longer hair just covers up the problem and they
Exactly.
don't have to worry about it. But I did have a funny story with a gentleman who had very prominent ears, who had long hair and he had to get it cut for a job promotion,
Oh,
and
no.
he didn't want to. So we were able to have him have his job promotion.
All right, well, sorry we are out of time, but always great having you here and always great information. Thank you so much for being here,
My
Dr.
pleasure.
Mealy.
Thanks for having
You can
me.
call the office for more information, 925-943-6353, or you can check them out on the web. What were your websites there?
drmealy.com.
or sanfranciscobreast.com. We're out of time. Thank you so much. It's always so much fun. See you next time on Body Beautiful.
The information and advice given on this program is for general informational purposes only. For medical advice on specific treatments, medical professionals should be consulted. You should not initiate a course of treatment without consulting a qualified doctor. The opinions expressed on the program are those of the guests and not those of Cron TV, its management, employees, or advisors.